Listen. I'm hoping that my microphones pick up the sounds that I'm hearing. Wind in the leaves, birds talking to each other, some ground squirrels. Heard a coyote the other minute. This is nature, and I've mentioned nature therapy in a couple of my videos. Nature therapy is when you get out to a forest preserve, the beach, the mountains, and you just start to think at the speed of what's around you. This isn't internet. The speed of internet with some people, I've seen some people get on multiple chat rooms and go really good with going between one conversation and another. Speed is great, but that's not healthy. This is health. Anxiety is a disease process where you have an abnormal response to a normal interaction. Anxiety will usually be generated either from genes or from something in your past. Everyone has a milestone that they go through in infancy, in childhood, in adolescence, in young adulthood, marriage, grandparenting, and then retirement. And every milestone is based on the last milestone. So you can see that if you were a child with a bad event that happened, every milestone for that child afterward will be off a bit. You might not manifest it in life, but when stressors come up, the reaction comes out. I see people in the immediate care center, chest pain, nausea, vomiting, numbness and tingling, back pain, all kinds of symptoms, shortness of breath, even passing out. I had one person with a seizure. These were all ruled out as being any specific problem, and we blamed it on anxiety or an anxiety reaction. There are very powerful medicines that my friends in psychiatry use to calm down the immediate response, and sometimes it's real important. If that reaction is interrupting interactions at school, at home, if it's interrupting your day, if you can't work, can't sleep, then you need the big gun medicines. Xanax is the typical one. That will bring down the anxiety immediately and keep it down for the life of the medicine. But if you do nothing about fixing the reaction to stress, you'll need your next dose of Xanax, and your next dose of Xanax, you'll be hooked on Xanax. It's putting a Band-Aid on a problem that you should be addressing with behavioral therapy. My friends in behavioral therapy, whether psychiatrists or psychologists or counselors, even hypnotherapists, are great at what they do nowadays. It's not just the couch time that you'll hear about that Hollywood people do or did back in the 90s. It's more dynamic than that. And there is a plan. It's not just have you sit down, listen to your thoughts, and then say, okay, see you next week. It's not that. There's more to it. Your behavioral therapist is actually trying to pick apart your interaction, trying to see how you're reacting to questions and answers, and then they're trying to formulate a plan for you, just like what I do in an integrative medicine clinic. I see what your history has been, I see where you're going, and I see what would be the best ways to get you successful at a sustainable lifestyle change, to get you out of disease. And anxiety truly is a disease process. I think a lot of my patients that don't like medicines or just are afraid of going to the doctor's office, they self-medicate. Marijuana is one, alcohol is another, risky behavior is another, eating is another. So when you keep on indulging in those Band-Aid rescues on your own and do nothing for getting in to get evaluated, you will need more and more of those Band-Aid rescues until the point when you have a side effect from the Band-Aid rescue. Marijuana leads to lung disease. The Beth cells in the cerebellum destroyed by marijuana chronically. Alcohol leads to liver disease, cirrhosis, poor job performance. Risky behavior will always lead to either motor vehicle accidents, sexually transmitted diseases, or withdrawal from society. So they're all bad. Even Xanax can be considered bad if only used and no intervention of behavioral therapy is made. So that's why I suggest that if anybody is on that medicine and not doing anything, I know the medicine might be getting you through life as a parent or a worker, but sooner or later the next milestone's coming up, and if you haven't changed the way you react to stressors or things around you, you might have an attack. You might get through life too and get to the age of 90 with Xanax, but the likelihood is that you will have other issues pop up. There are herbs that I like to use: 5-HTP, magnesium, St. John's wort, inositol, even skullcap, and I've spoken about them in previous talks. They're all great, but you have to have somebody guide you as far as how to use them, and then you still need to have a plan to get off of those things and change the way you react to your normal environment. Remember, it's an abnormal response to a normal situation. So you need to have an outside opinion look and devise a plan for you. If I was to tell my guys with anxiety, okay, go ahead and meditate, take these medicines, I'll see you in 3 weeks, you're probably going to fail. I hate to say that, but that's how powerful anxiety is nowadays. And I think part of it is because we ignore it. And we go on to the next milestone and we kind of put on a coat on top of another coat on top of another coat. It gets to be where you can't support yourself anymore, and you got to take off all those coats to get to the bottom layer of what's going on. And that's where my behavioral therapist will come in handy. Anybody in the behavioral field is usually pretty good, but I have my choice suggestions of where to go. So it's always important to realize that there might be an issue. It's always important to know when to say, stop, there is a problem, I need the medicines. It's also important to know when to step away from stress, whether it's FMLA, short-term disability. We can always design those things, but you have to get in to the medical professional to get the evaluation done. And insurance or no insurance, I would still say there's ways around it. Don't just think that if you don't have insurance you can't afford it, you just have to deal with it. It's going to get worse. So the investment must be made. Always seek out help. Always know that you won't be able to do it on your own. The likelihood of success on your own is low. Relapse is always there. Be prepared for the next stressors, and holiday season's a stressor. Birthdays, death anniversaries, they're all stressors. Changing a job, stressor. Actually getting married is a stressor with a lot of couples. That's why if you're not ready for the stress that's coming, you're going to manifest, and then it's going to rub off on the closest person to you who you love.